Good day everyone, I'm Jan Alan Ambistao from BSN1C Group 2 and today I'm going to perform a return demonstration on assessing the thorax and chest. So moving on to the preparatory phase, first is you're going to reassess the patient's previous medical records if available. Then you're going to determine the scope of assessment needed and prepare necessary equipment. Next is you're going to perform hand washing and don gloves if deemed necessary. So in here, I'm going to use alcohol-based hand rub to prevent or avoid the spread of microorganisms. Next is you're going to assemble the equipments or gather the supplies needed. So here I have my equipments. The next is you're going to introduce yourself to the patient and verify the client's identity. Good day, sir. I'm your student nurse for today. My name is Jan Alan Ambistajo. And may I ask your name, sir?
John Mark Melcotone,
Your birthday,
June 25, 2006,
your religion,
Roman Catholic,
civil status.
single.
Okay. Thank you, sir. Next is you're going to explain the procedure to the client so that the procedure will run smoothly. So today, sir, we're going to assess your thorax and chest so that we can see if there are any unusual findings that we may gather in regards of your thorax and lungs condition. Okay?
Okay.
So next is you're going to position patient comfortably and provide privacy. So in a hospital setting, so let's just let's just assume that we are in a hospital setting and that there are curtains around. So that is also a way of providing privacy as well as locking the doors or windows of the room. So, are you comfortable with your position, sir? Okay lang kasi may position?
Yes, nurse.
Okay. Then moving on to the assessment phase, in thorax or lungs, first is you're going to inspect respiratory rate, rhythm, depth, and symmetry of chest movement anteriorly, posteriorly, and laterally. So, karon sir, I'm going to inspect your respiratory rate, sir, as well as your rhythm, then your chest movement. So, normal breath lang, sir. Sige, sir. Inhale. Exhale. Normal breath lang, sir. Normal lang ginawa. Okay. Next is you're going to inspect the antero-posterior to lateral ratio, costal angle, spinal deformities, and condition of skin. So may I ask you, sir, if may I ask you to take off your clothes, sir, your shirt or your shirt. Okay. This is. Sige, sir. Ginawa lang, sir. Normal breath. Ipagsandig, sir. Normal breath. Sige. Okay. The next is you're going to lightly palpate antero-posterior chest for tenderness and crepitus. So, sige sir. Sige sir, normal breath lang sir. Okay. Moving on to the assessing for chest extortion. So first is you're going to anteriorly place hands vertically on the chest with fingers spread on the costal margin and thumbs together at the costal angle. So next I'm going to pwede okay lang ba sir? Gunitan ako to sir.
Yes, nurse.
Okay, sige sir. Okay, normal breath sir. Sige, normal breath. Okay. Next is posteriorly, place hands vertically on the chest with fingers spread and the thumbs together at the spine of the 8th to 10th rib. So sige sir, isog lang diri sir gamay sir. Ana sir tagilid gamay ana. Okay. Sige sir, ginawa. Normal breath. Sige. Okay. Okay. Then by that you're going to in doing that you're going to feel for any for equal expansion of the chest. If absent, decreased or unequal, move up the chest. The next is assess for tactile fremitus. Place the balls of your fingers with your hands hyperextended or the ulnar surface of your hand on the patient's chest. Then have the patient say 99 as you palpate vibrations. Then next is you're going to note for level of where thermitus is palpable, increased, and diminished or absent. So, sige sir, karon sir, ako gunita ng imong chest sir ha. Tapos, I want you to say 99 lang sir, okay?
99.
No, 99. Sige sir. Sige, 99.
99.
Sige sir, repeat. Repeat lang sir.
99. 99. 99.
Sige sir.
99. 99. 99.
Okay, thank you. Then in percussion for anterior, posterior, and lateral thorax, first is you're going to perform a midget percussion in a systemic pattern. First is you're going to ask the client to bend the head and fold the arms forwards across the chest. Then you're going to percuss in the intercostal space at about 2 inches intervals in a systemic sequence. Then you're going to compare one side of the thorax with the other and note for the areas of resonance, hyperresonance, or dullness. Then percuss the lateral thorax every few inches, starting at the axilla and working down to the 8th rib. So karon sir, I want you to magtagilid ka gamay sir. Sige sir, tagilid lang sir. Ana, sige. So I want you to bend your head sir, lower sir, tapos i-cross na mo ang imong arms. Sige sir ha. Mag-percuss ko karon sir. Sige sir, normal breath. Sige sir. Okay? Sige sir, okay na sir. Balik na sa posisyon. Next is for assess for diaphragmatic. Next is assess for diaphragmatic excursion. So first is you're going to have the patient take a deep breath and fully exhale. Then precause the level of the diaphragm and mark. Then you're going to have the patient take a deep breath and hold it. Then precause the level of the diaphragm. So karon sir, I want you to take a deep breath and fully exhale. Tapos ako din i-palpate ang imong then ako din i-percuss ang imong diaphragm. Okay lang gamay sir. Dito gilid. Na. Okay, straight lang. Sige. I want you to inhale sir, take deep breath. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Okay? Then ako sa din i-measure sir katong ako nakuan. Sige sir. Balik na sir. Then moving on for the test for normal breath sounds and abnormal voice sounds. So first is you're going to auscultate the chest over auscultatory sites, anterior, posterior, and lateral, using the flat disc diaphragm of the stethoscope in a systematic manner. So, you're going to listen to one full respiratory cycle at each site. So, karon sir, mag-auscultate ko sa imong chest. Sige sir, normal breaths lang gyapon sir ha, okay?
Okay na.
Sige sir. Ginawa. Okay. Okay. Okay, ginawa lang sir. Okay, ginawa, normal breath. Okay. Next is you're going to ask the patient to take slow, deep breath through the mouth, then listen to at each point to the breath and sounds during a complete inspiration and expiration. So karon sir, I want you to take a deep breath and exhale gamit ang imong mouth na pud sir ha. So sa mouth lang pag ginawa ha, okay? Sige. Baba lang. Sa baba lang inhale. Exhale. Okay, normal breath. Okay, sir. Baba lang sir ha. Okay. Then you're going to note normal, abnormal, and adventitious sounds. So next is you're going to have the patient cough, then listen to see if sound has cleared off, or if adventitious sound are heard. So karon sir, I want you to cough sir. Huwag lang sir ha. Okay, sige sir, cough. Sige. 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 Okay, thank you. Next is you're going to have the patient say E, and it will sound like if the it will sound like over the affected area. So karon sir, I want you to say E. E sir ha, E. Okay, say E.
E.
Sige sir.
E.
Sige.
E. E.
Sige sir.
E.
I-prolong sir. E.
E.
Sige.
E.
Again.
E.
Okay. Then next is you're going to have the patient say 1, 2, 3 and clear transmissions of spoken voice sound over affected area. Then Karen sir, I want you to say 1, 2, 3, okay? Okay.
1, 2, 3.
Okay.
1, 2, 3.
Okay.
1, 2, 3.
Okay.
1, 2, 3.
Okay. The next is you're going to have the patient whisper 1, 2, 3 and clear transmission of whispered voice sound over the affected area. Karon sir, I want you to whisper 1, 2, 3 sir. Pina-whisper lang. Pinanghong, okay? Sige. 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 Okay. Then moving on to the heart and central vessels. So you're going to measure for jugular venous pressure. So first is you're going to position patient with the head of the bed at 30 to 45 degree angle. Then place a ruler vertically perpendicular to the chest at the angle of Lewis or the sternal angle. So karon sir, I want you to lay down sir. Tapos higda lang sir. Sige sir, higda ka karon sir. Sige. Then I'm going to sir ha. So in this, you're going to identify the highest level of the jugular vein pulsation. If unable to see pulsations, use the highest level of jugular vein distension. Next is you're going to place another ruler horizontally at the point of the highest level of the venous pulsation. Sige sir, normal breath lang sir. Okay. Then you're going to measure the distance of the jugular vein of the pressed vein up from the chest wall. Then you're going to lightly palpate each carotid separately with caution, and note for the rate, rhythm, amplitude, contour, symmetry, elasticity, and frills. Karon sir, I'm going to lightly palpate each carotid sir ha. The next is you're going to have the patient hold breath and auscultate the carotid with the bell portion of the stethoscope for Brutes. So karon sir, I want you to take deep breaths sir ha. Then exhale lang gyapon sir. Sige sir. Inhale. Take deep breath sir. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Okay. Then also, oscillate the jugulars with the bell portion of the stethoscope for venous hums. Okay, sir. Sige, sir. Again, sir. Take deep breath. Okay. Exhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Okay. Next is you're going to assess for precordium. So inspect for pulsations on the precordium, paying particular attention to the apex area. Then you're going to position patient in supine position with the head of the bed elevated between 30 to 45 degree angle. Stand on the patient's right side and look for apical impulse. Next is you're going to palpate the apical impulse, then remain on the client's right side and ask the client to remain supine. Then use one or two finger pads to palpate the apical impulse in the mitral area. Okay, sige sir, normal breath lang sir ha. Sir. Then you're going to percuss the area to determine the cardiac borders. Next is you're going to auscultate heart rate and rhythm. So place the diaphragm of the stethoscope at the apex and listen closely to the rate and rhythm of the apical impulse. Okay, sir. The next is you're going to auscultate each site, which is the apex, the urge point, base left, and base right. Then note the S1, S2 extra sounds or murmurs. Then auscultate with the patient, assuming other positions, and ask the client to assume the left lateral position, and use the bell of the stethoscope and listen at the apex of the heart. The next is you're going to ask the client to sit up, lean forward, and exhale, and you're going to use the diaphragm of your stethoscope and listen over the apex and along the left sternal bladder. Okay, sir. Next, sir, is I want you to sit down, sir. Okay, sir. I want you to lean forward, sir. Lean forward, sir. Dungo. Dungo. Tapos, I want you to inhale of normal breath lang, sir, ha? Normal breath, pero mag-exhale na din ka, sir, ka nang pinakon sa exhale. Exhale. Sige, sir. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Okay. Okay na, sir? Okay na, sir? So, pwede na ka magsalina, sir? Then, moving on to the termination phase is you're going to review the information gathered or obtained during the assessment phase and discuss findings to the client and present to the client the possible plans to resolve health concern if present. So, karon sir, mag-review ta sa imong mga sa atong nagather nga information during the assessment. So ang imong normal ang imong breathing pattern. Then ang imong walay mga murmur and your heart rate is normal. Your heart rate and rhythm normal lang, sir. Tapos ang imong apical impulse pod, sir, normal lang. The next is you're going to measure the client's understanding of the plan and the need for further teaching. Provide the client the opportunity to clarify or ask questions if or he or she has any concern. Do you have any questions, Pastor, or any concerns?
No, nurse.
Okay. Then you're going to end the interview politely. So, thank you for your cooperation, sir. I hope you you stay healthy as always, sir. Ha? Okay, keep your healthy lifestyle because everything is normal. Okay.
Thank you.
Okay. Then next is you're going to do aftercare and fix the equipment and arrange it properly. So in prior to that, you're going to perform hand washing or hand hygiene. The next is you're going to document the findings in the client's record for further information. So that's it for assessing thorax and chest. I hope you learned something. Thank you and God bless.